Happy Wednesday. I know how happy it truly is. I'm having to take my planet off. I don't. I'm struggling. It's about 11. I just got out the shower. I've been up since like 7:30, just in so much pain. Like my legs, my feet are burning, and they're cramp. I know I got kind of dehydrated yesterday. Well, I guess the thing is I haven't really had a whole big appetite. So I haven't really been drinking a whole lot. Cause my stomach is just not right. Like the pain in my back, and neck is excruciating. My skin hurts. So I did speak with the pain management. The reason I'm laying on this shirt is because I washed my hair last night. Pain management, they said I could get my SI joint injection, but when I talked to the girl, because I was calling her back to give her a date, I just told her the intensity of the pain has gotten so severe. Like, I want to make sure that I don't need an epidural versus an SI joint injection, based on the symptoms. I really feel like I need a new MRI of my back. But I'm just not in a good space. Face is kind of, my butterfly rash has been like reappearing. Like my energy level is horrible. If I cook something or if I wash dishes, like one simple task, no matter how big or how small, I'm just zonked after. So I'm seeing, after telling the girl, the pain that I'm having, so I'm going to see the doctor tomorrow. So we can go over, the severity of everything to make sure I'm getting the right procedure done. I'm looking at, I wanted to do it like on I think it's the 17th. It's a Wednesday. Because we have a track meet on the 13th. But I don't really know if I can handle waiting that long. He had openings for the 3rd. So hopefully tomorrow he'll still have openings and I'll just get it out of the way. But the pain is to the point to where I feel like I want to throw up. That's how bad it is. I need to get up to try to eat something else. I had a Pop-Tart. But yeah, that's not breakfast or a good meal. But I really need to try to just force the medical marijuana today. Because it's just bad. Like, if you've ever walked outside and the asphalt or concrete is so hot that it burns, that's what my feet feel like. It feels like that, and that I have fire ants. Like, I know I have peripheral neuropathy. No, I'm not a diabetic. I've just had 4 back surgeries and it has wreaked havoc. And I've always had the pain, which I've been able to manage through the years. But after this elevator accident last year, something's not right in my back. And I don't know what it is. You guys already know, if you're not new to the channel. I do have my neck surgery scheduled. I have it scheduled for August, the end of August. That gives me time to get prepared, see the new rheumatologist next month. My husband needs meniscus surgery. So I'm trying to hopefully he can get his taken care of before mine. Because he's been suffering for over a year in pain, swollen knee, it's bad. So yeah, it's just really difficult right now, but I just wanted to pop on just to show my face. And of course, I will come back on tomorrow once I see the doctor and all of that jazz. Yeah, I don't know what else to do at this point. Like, I want to cry because I'm just so uncomfortable. And yesterday I went to track practice to time, and it was just difficult, very stressful. So, but I'll come back on tomorrow once I go to this appointment. Good morning, guys. Happy Thursday. I said I was gonna come back out. My hair looks a mess, but I'm not taking it down. The top looks horrible, but I got these little bonnets, so hey, I'm gonna make it work. It's 10:12. I'm going to the pain management appointment that I told you about yesterday. So let's recap yesterday. I literally did not do anything other than I barely got up to even eat when I was supposed to. The pain was so intense that I couldn't, it was bad. So I pretty much stayed medicated on my medical marijuana between the tincture. So I did my capsule that I do in the morning anyway, and then I did my tincture oil, like a half dose, and like some vape puffs, and I didn't actually fall asleep until I want to say it was probably like 3 something. My body just couldn't wind down. But then my thing is, like, I'll get in bed and say, well, I'm gonna just do something on my phone so I'll get sleepy, and that never works for me because my mind will still be going. So I have to like put my phone.
Accident ahead in 3.1 miles. You're still on the fastest route.
Sorry, it's my GPS. But yeah, I just try to turn the phone, like leave it alone, and then I can fall asleep normally with no issues. But I think I only slept for like maybe an hour and a half. So yeah, I'm still like super tired. Like, I had my alarm going off since 8:50, and I literally hit it like 3 or 4 times. I'm gonna go by the dispensary to try to get some more tincture oil and a vape pen because I'm running low, and normally that lasts me for like a whole month and almost like a month and a half, just depending. But since I've been using the tincture oil through the day too, to control the pain. Alright guys, so done at the doctor's appointment. So what we're going to do, I'm scheduled for next Wednesday. I'm going to get a caudal epidural. I've had caudal epidurals in the past, but I want to say it was only at like 05 S1, I don't know, but he's going to do from L4 all the way to S1 with this epidural. And normally they do everything on the right side because that was always like my, when I had my fusion, it was on the right side of L5S1. But this time he's going to do both sides of the nerves to try to get me some relief. So that will give me a good, hopefully some relief. They've changed his surgery schedule, so I have to get there at like 7 in the morning. That's like so early. But yeah, but that's where we're at right now, and he's concerned because I'm having lots of weakness. still like in my legs, and my muscles are really tired. And he's just like, your autoimmune and your lupus stuff is like really going haywire, and he'll be glad when I can get in with this new doctor so we can try to get some type of regimen treatment, something. He did suggest me looking into doing B12 shots, so I'm probably just gonna call my primary and see if I can just get some maybe labs ordered. I don't know how that works when it comes to B12, like injection wise. I know you have to have a script for it, but maybe I should just start taking just some like B12 like vitamins, which I know it'll take a lot longer to get in my system. But he was saying that I really should need like a boost of B12 to try to help with some of the stuff that's going on. And of course, because of the vitamin D being low, it's like an up and down thing always. So with that, that of course causes more pain. But yeah, right now I'm about to go into the dispensary to get the medical marijuana. I normally call it in, but they're like on their game. Like as soon as you go in, I don't know, it's because they got so many people that work there, but they get the stuff in and out really quickly. So I'm gonna go run in there really quick to get what I need. I really need to go like by the dollar store because I'm working on my hurricane preparedness video for my family channel, which I will probably put it on this channel too. So I'm trying to get all that stuff lined up, and I need to get a few more items that we did not have. But Florida has tax-free for hurricane preparedness. I want to say it starts Friday. So I'm going to try to figure out if we're going to take advantage of it then. So I'll come back.